Tick-borne diseases are diseases or illnesses transmitted by ticks. As the incidence of tick-borne illnesses increases and the geographic areas in which they are found expand, it becomes increasingly important that health workers be able to distinguish the diverse, and often overlapping, clinical presentations of these diseases. Tick-borne illnesses are caused by infection with a variety of pathogens, including rickettsia and other types of bacteria, viruses, and protozoa. Because ticks can harbor more than one disease-causing agent, patients can be infected with more than one pathogen at the same time, compounding the difficulty in diagnosis and treatment. Diagnosis and treatment: in general, specific laboratory tests are not available to rapidly diagnose tick-borne diseases. Due to their seriousness, antibiotic treatment is often justified based on clinical presentation alone. Exposure: ticks tend to be more active during warmer months, though this varies by geographic region and climate. Areas with woods, bushes, high grass, or leaf litter are likely to have more ticks. Those bitten commonly experience symptoms such as body aches, fever, fatigue, joint pain, or rashes. People can limit their exposure to tick bites by wearing light-colored clothing, using insect repellent with 20% to 30% DEET, tucking their pant legs into their socks, checking for ticks frequently, and washing and drying their clothing. Another natural form of control for ticks is the guinea fowl, a bird species which consumes mass quantities of ticks. So good animal husbandry can reduce tick prevalence in a high tick prevalence area. Examples: major tick-borne diseases include bacteria, Lyme disease or borreliosis; organism, Borrelia burgdorferi sensu-lato; vector, deer tick, I. pacificus, Iricinus, I. sulcatus; endemic to North America and Eurasia. Symptoms: fever, arthritis, neuroborreliosis, erythema migrans, cranial nerve palsy, carditis, fatigue, and influenza-like illness. Treatment: antibiotics. Relapsing fever, organisms, Borrelia species such as Borrelia hampsa, Borrelia parkeri, Borrelia duttoni, Borrelia miyamotoi; vector, ornithodros species. Regions are primarily in Africa, Spain, Saudi Arabia, Asia and in certain areas of Canada and the western United States. Symptoms: relapsing fever typically presents as recurring high fevers, headaches, and muscular pain, with less common symptoms including rigors, joint pain, altered mentation, cough, painful urination, and rash. Treatment: antibiotics are the treatment for relapsing fever, with doxycycline, tetracycline, or erythromycin being the treatment of choice. Typhus: several diseases caused by rickettsia bacteria. Rocky Mountain spotted fever, organism, rickettsia; vector, wood tick, D. andersoni; region, east, southwest; vector, Amblyomyxa genans; region, Sao Paulo, Rio de Janeiro, Minas Gerais. Symptoms: fever, headache, altered mental status, myalgia, and rash. Treatment: antibiotic therapy, typically consisting of doxycycline or tetracycline. Helvetica spotted fever, organism, Rickettsia helvetica; region, R. helvetica, confirmed common in ticks in Sweden, Switzerland, France and in Laos; vector, region, S. Number 1 Ixodes ricinus is the main European vector, vector, region, S. Number 2, please add if more vectors are found. Symptoms: most often small red spots. Other symptoms are fever, muscle pain, headache and respiratory problems. Treatment: broadband antibiotic therapy are needed. It is likely that phenixamphenicillin is sufficient. Ehrlichiosis anaplasmosis, organism, Ehrlichia chaffiensis, EECI, vector, Lone Star tick, I. scapularis; region, South Atlantic South Central. Tularemia, organism, Francisella tularensis, A. americanum; vector, D. andersoni, D. variabilis; region, Southeast, South Central, West, widespread. Viruses: tick-borne meningoencephalitis, organism, TBEV also known as FSME virus, a flavivirus from family Flaviviridae; vector, deer tick, Ixodes ricinus, Ixodes sulcatus; endemic to Europe and Northern Asia. Colorado tick fever, organism, Colorado tick fever virus, a cultivirus from Reoviridae, vector, Dermacentor andersoni, region, U.S. Crimean Congo hemorrhagic fever, organism, CCHF virus, virus, from Bunaeviridae, vector, Hyaloma marginatum, Rhipicephalus bursa, region, southern part of Asia, northern Africa, southern Europe. Severe febrile illness organism, Heartland virus, a phlebivirus, from Bunaeviridae, vector, Lone Star tick, region, Missouri and Tennessee, United States. Protozoa, babesiosis, organism, Babesia microti, Bieki, vector, I. scapularis, I. pacificus, region, northeast west coast. Cytoxoonnosis, organism, C. felis, vector, D. variabilis, region, south, southeast. Toxin, tick paralysis, cause, toxin, vector, D. andersoni, D. variabilis west, region, east, vector, Ixodes holocyclus, region, east. See also, ticks of domestic animals, references. External links, Tick-Borne Diseases, Recommendations for Workers and Employers, National Institute for Occupational Safety and Health, Tick-Borne Diseases, National Center for Infectious Diseases, Tick-Borne Disease website, Massachusetts Department of Public Health, Tick Bite Fever, Health 24, Ixodes scapularis, 3D animation of deer or black-leg tick from U.S. Army site.